Hi, Neil Shearing here from Epicentering with a video update for you. What I'd like to do in this video is continue to look at the causes of depression and specifically the relationship between stress, inflammation and trauma. Now, in a previous video, I was looking at the overlap between the symptoms of depression for people who have viral illness and people who have outright depression. So there's similarities. And I thought maybe the common factor could be inflammation, that the distress that people encounter in their lives, which gives rise to inflammation and then depression, could be similar to when people have a viral infection and have similar symptoms to those of depression. So maybe the commonality was inflammation. So that's what the earlier video went into in detail. So that video was called Is Depression a Mind Virus? And I'll link to that in the description if you want to see it. Now, a lot of the thinking that I've had around inflammation was triggered by this book, The Inflamed Mind by Professor Edward Bulmore. Very, very interesting book. Highly recommend it if you're into this specific subject. And one of the things that he mentioned, there are several really interesting stories that he mentioned in the book. One of them was about a group of, I think it was 15,000 children in England, southwest England, that they looked at age 9, and they gave them a test for depression, and they also looked at their circulating cytokine levels. So they looked at interleukin-6, which is a cytokine and a measure for their inflammation. And they found that those that had the highest levels of circulating interleukin-6, so the highest levels of inflammation at age 9, went on to be the ones that were most likely to get depression at age 18. So there are lots of studies in the book, The Inflamed Mind, like that paint a picture of inflammation being critical to the story of how people develop depression. But one of the things that bothered me in the book was this paragraph where it says, to get a rough idea, let's start from the fact that about 350 million people, or 7% of the world's population, had an episode of MDD, major depressive disorder, in 2012. How many of these people would we expect to pass a blood test for inflammation? If we use CRP as the biomarker, so in that study I was talking about, they used interleukin-6. CRP, C-reactive protein, is another biomarker for inflammation. So if we use CRP as the biomarker and 3 milligrams per litre as the cutoff point for being inflamed, then we might expect about a third of the patients with MDD to be eligible for treatment with a new anti-inflammatory drug. Now this kind of confused me, because if inflammation is central to the story of how people end up with depression, how come only 1/3 would actually pass this test for being inflamed? Now, I don't know if 3 milligrams per litre is an appropriate cutoff point. I have to assume it is. But if you use that as a cutoff point, then this part of the book is saying that 2/3 of people with major depressive disorder wouldn't have CRP in the blood in excess of 3 milligrams per litre. So 2/3 wouldn't pass this test. I thought that was really interesting, and I was thinking, why would that be? So I've got here a model of depression, a simplistic model. So you've got different types of stress. You've got psychological distress, emotional distress, and physical distress. Psychological distress can be acute or chronic. So acute might be bereavement or a divorce, and chronic could be something like financial stresses or long-term being a carer for someone else. Physical stress would be something like an illness, such as the viral illness. And emotional stress is obviously the feelings that you have about any given situation in life and whether you can cope. So disappointments and powerlessness, worthlessness, feelings like that. So the stress that people are under comes in different formats, and they obviously interrelate. If you're having a strong viral illness, then that's going to put emotional stress. You're not going to feel good. And psychological stress, like bereavement, causes feelings and emotions as well. So they kind of interrelate, which is why the arrows point between them. But then the idea is they give rise to inflammation in the body. And inflammation in people who are susceptible causes depression. And depression with those arrows is kind of like something that self-reinforces and gets worse over time. So the question then is, why, if this model is correct, do only 33% of people with depression have that level of C-reactive protein if they were to test them? And my suggestion here in this video, my idea, is that maybe trauma acts as an inflammation sensitizer. So I'll explain that in a bit more detail. So take this person, for example. They have 3 units there of inflammation. So just to make it simple, that would pass the test of 3 milligrams per litre of C-reactive protein in the blood. Say each of those blocks is 1 milligram per litre. They have 3 milligrams per litre. They pass the test, CRP positive. They're depressed, and that story then would be that the inflammation is contributing to or causing the depression. But how about this person who only has 1 unit of the inflammation? So 1 milligram per litre in this simplified example. They then would be depressed but not have passed the test there for the C-reactive protein. What if they had trauma that amplified the effect of the inflammation? So in this case it tripled it. So there's 1 unit of inflammation but 3 units of trauma. So the trauma in this sensitive individual is amplifying the effect of inflammation in the body. Therefore they're depressed, even though they didn't pass the test of 3 mg per litre of the C-reactive protein in the blood. And then another example would be this person doubles the inflammation markers. So they've got 2 units of inflammation. Still not enough to pass the 3 mg per litre C-reactive protein test. But they're depressed. Why are they depressed? Because the trauma in this case doubles their sensitivity to inflammation. And they effectively have 4 units of inflammation because the 2 of inflammation is doubled because of the trauma effect. So this is how my thinking is evolving, that there's an interplay between the stress, the inflammation, and the trauma. And that could explain why only 1/3 of people would actually pass this test of 3 mg per litre of C-reactive protein in the blood. And the 2/3 that don't pass that test would have lower levels of circulating CRP, but they would be sensitive to it because of a past history of trauma. Interestingly enough, in this book, The Inflamed Mind, as far as I can tell, it doesn't mention trauma. So this trauma effect could be a missing piece of the jigsaw as to why 2/3 of people with depression don't test positive or wouldn't test positive for inflammation, but are still depressed, despite inflammation obviously playing a really big role. So maybe this trauma sensitizer effect is the missing part of this jigsaw. So I'd love to know what you think. Does this make sense to you? Do you think trauma plays a role in the development of depression and maybe acts as a sensitizer to inflammation going on within the body? Please leave a comment below, let me know your thoughts, and if you'd like more videos on this, understanding depression, and also moving on to what we can do about depression to help heal depression, then please like, subscribe, and share the video. I'd really appreciate that. Thanks for watching.